be formless, shapeless.
What up? So, I'm finally home chilling in a long day at clinical labs. That's pretty much all this video is going to show you. Some of the things that we were doing in labs today includes colonoscopy care, IV sites, regulation of IV fluids and IV medications. We also did some trach care and trach suctioning. Yeah, I condensed a lot of it, but I just wanted to show you what a day of clinical labs was like whenever you're there 8 hours out of a day instead of just the 1 or 2 with your more traditional programs. Check it out. What a beautiful day it is for labs. Very early. And yeah, this is my box of materials. Should definitely be more prepared. Kind of rushing this last minute, and I really don't know everything that I need. I've walked up and around with a big box of Dero gloves, medication administration today, every starter kit.
This should not be overtly painful. Okay, I always tell them, if you've had your blood drawn before, it's probably not going to hurt any worse than that. If they are, what do I use? Iodine. Okay, you can use iodine. Okay, it's just like coming in for a landing on an airplane. Okay, you want to be as straight as possible next to that vein, because if you're at this kind of an angle, 45-degree angle, heaven forbid a 90-degree angle, I'm gonna go right through that vein. Okay, so think about kind of like an airplane coming down to the ground. All right, and then I'm just gonna go in. Okay. Sometimes increasing the rate of the saline so it's diluting the potassium down will help. Okay. Sometimes you may just need a bigger vein.
You do need to have a doctor's order to be able to draw. Some places you don't, so just check. And you want to cover whatever section of the line.
Why would a patient have a trach or tracheal suctioning? 120 is okay. Okay, setting it up to 120. You're going to set it at continuous suction, not intermittent. Okay, if you're watching their oxygen sats and their oxygen sats have dropped, let them come back up first.
If I have to give any suggestions on clinical labs, I would say ask plenty of questions. If you don't understand, just ask. A lot of people get kind of scared or think that they might ask the wrong question. Forget that. Just ask. You get a better understanding and it'll make you a better nurse. Also say practice as much as you can. Some people in there will joke around, but take that time valuable. I like to have my clinical lab instructor look at me while I'm doing my skills. Volunteer as well. A good tip I think is to fail early and often. You'd rather want to mess up on these labs and be corrected instead of wait till they be tested on your skills and you're out there confused and getting points taken off. So it is now 3:30. Just finished up these labs. We've been out here since 8 a.m. this morning. Pretty much a full work day. At clinical labs today, we went over IV insertion and the management of IV fluids and IV medications. We also went over some ostomy care, how to care for a stoma and change an ostomy. What else did we do today? We did a lot. We also went over trach care and trach suctioning, about how to maintain sterile technique throughout that. Pretty much it's kind of hard for me and my school to do this because we go out of each semester, it's 2 weekends that we go out and do our clinical labs. So it's not like we're doing it an hour a day a week. We kind of hit it hard for 2 weekends, and it's a lot of information to take in, especially after working the full time, the whole week. I mean, shit, Monday through Friday, 8 hours a day, so it can get pretty exhausting. I took a Red Bull today, so I'm kind of coming down off of that. It's been a long time since I took one of those. I've been trying to stay healthy. So I'm about to hit this drive back home, go over some of my skills with Monica, try to learn, make sure I can apply it, and know what I'm doing so I can practice efficiently next weekend, and then we'll have our test the following week. So I'll take this drive back home, and if you have any questions, be sure to ask me in the comments. I mean, I know whenever I was looking about starting nursing school, I was kind of like, what is labs? What happens in labs? So if I can give a little more in depth about what was happening, I do not mind doing so. But yeah, peace. I'll talk to you soon.